All right. I'm just going to give it a few seconds for everyone to join in. Great. Well, hello and everyone, and welcome to this virtual pharmacy school fair workshop. I am Danielle Stubbs-Kirkland from AACP, and I will be moderating this session. We'll get started with today's session, not just counting pills, exploring the clinical side of pharmacy in just a moment. But first, just a few housekeeping items. Although you'll be muted throughout the entirety of the webinar, please feel free to ask questions in the Q&A window throughout the webinar. We have saved some time after the presentation to address any questions. If there are any questions that we do not get to, the speakers will be available in their booths during the expo hours from 5 p.m. to 7 p.m. Eastern, so we highly encourage you to visit their virtual booth at that time. Additionally, the presentation will be recorded and available immediately afterward in the Sessions tab. Now I will turn it over to our speakers to go ahead and get started.
Thanks, Danielle. Hi, everybody. Good morning or good afternoon. It's still morning here on the West Coast, depending on where you're joining us from. My name is Brandon Nuziali. I am the Assistant Dean for Student Affairs at Pacific University School of Pharmacy, and I'm excited to just chat with you a little bit more about our profession. And I have another faculty member along with me. I'll let him introduce himself as well.
Hello, everyone. My name is Nathan Doctor. I'm a pharmacist and I'm an assistant professor at the School of Pharmacy at Pacific. Um, as Brandon mentioned, we're really excited to share a little bit about what pharmacists can do outside of maybe what people think that they can do. And so we'll go ahead and get started with our presentation.
And I also think you're able to participate via the chat, so feel free to populate answers. We have a couple kind of open-ended questions, so feel free to share your thoughts as we go along. So overall, our goals for this short session is really just to describe how pharmacists contribute to patient care on healthcare teams, demonstrate how pharmacists think through medication problems. So especially Dr. Doctor likes to say a lot of our duties as a pharmacist are very cognitive. And so often it's hard to see out from an outside perspective everything that's going on to actually understand what pharmacists do. So I think that will be part of what we try to explore today. And also highlight some multiple career pathways available through the Doctor of Pharmacy degree, possibly beyond what you're aware of and what most of the public generally thinks about. So when I do a similar talk like this, either with the general public, with elementary schools, with high schools, I always usually start with this question, and it's, what would the public say if you ask them what comes to mind when you think of a pharmacist? Feel free to throw anything in the chat that you think either you think of when you think of pharmacy, or if you ask family members, what would they say? And while you're thinking about that, you might think about, would the public describe pharmacists as professionals who directly work with prescribers and nurses to make treatment decisions? Well, I don't see a ton in the chat just yet, but if you are thinking about that in your mind, I think what we encounter when we're out in the public is that most people are very aware of community pharmacy. Some are aware that also they find pharmacists in the hospital, but in general, people connect pharmacy with getting meds to people. Filling medications, getting meds, helping patients understand their meds is generally the role that we typically hear. But we don't always hear like, oh, they're a member of the healthcare team. They're helping to contribute to making therapeutic decisions on how to improve patients' health. We don't always hear about them in the public health sector. We certainly don't hear very frequently that they're able to manage conditions independently. And so all of those things are also true. And so helping both you guys understand what is available to you in this profession, but also helping the public understand what are the roles that a pharmacist can play that is well beyond what I think most people encounter. So if you look at the healthcare team overall, we like to say that pharmacists are the medication experts on the team. If you compare our training to a lot of the other healthcare professionals, our focus is certainly on the medication and treatment, where our physician colleagues, our nurse practitioner colleagues, while they have some pharmacology or pharmacotherapy within their education, their focus is generally more on diagnosis, and that scope is large. So having a focus for them on treatment and how medications work, there isn't a lot of time for that. And so their focus is not on those things. And so having a member of the team that is their focus, we know helps improve patient outcomes, and helps protect patients from possible errors, whether they're medication errors or otherwise, and also help to improve their general health. We do this through helping the team choose the right medication for the patient. That might be evaluating what other medications they're on for potentially dangerous drug interactions. That might be adjusting a medication's dose based on their liver function or kidney function or age and weight. It might also just be an adjustment based on other medications that they're on, depending on how that might affect drug levels. We're a pretty patient-facing profession, and so educating patients is also a big component, especially in the community setting, but also in the health system setting as well. If you are someone that you're thinking, well, I don't really want to be working with patients that closely, that's also an option. And so you could say that we're very patient facing and we're also very healthcare team facing. And so you can have lots of engagement with other people that might not be patients. It might be colleagues, it might be other members of the team. It might be really focused on the dispensing of medication, depending on where you are in the system. We're also, what most people don't often think about, is that we're also involved in the outcomes or monitoring of whatever it is that the team has recommended the patient utilize. And so that can include monitoring for the success of that treatment. That could be monitoring for specific side effects. That could be ordering labs and checking to make sure that there isn't a adverse effect related to lab outcomes, or there is the intended effect in terms of what lab outcomes there are. We also might do things like monitor vitals, like blood pressure, oxygen saturation, depending on what the treatment issue is that's going on. So today, you hopefully are getting the picture that, like, being a pharmacist, depending on your setting, can involve a lot more than simply just getting the medication to the patient. And so we're going to have a few examples where we have you think a little bit like a pharmacist and identify how to resolve some real patient problems that we see kind of on a regular basis to help illustrate kind of the cognitive tasks that pharmacists go through on a daily basis. So our first situation is to help you start to think like a clinician. So we have Mr. Lopez. He's a 62-year-old male. He has conditions like diabetes, hypertension, which is high blood pressure, and hyperlipidemia, which is high cholesterol. He's on a few medications. He's on metformin that he takes twice a day, which is used for diabetes. He's on lisinopril 40 once daily, which is for high blood pressure. He's on atorvastatin 80 once daily, which is for the high cholesterol. And then hydrochlorothiazide 25 milligrams once daily, which is also used for blood pressure. He reports that he's been feeling dizzy every time he stands up. What questions do you think, and feel free to populate the chat here, might you ask to help get a better understanding of what could be the cause of his complaint, which is the dizziness? How long has this been going on? Great. So getting a better idea of the history of the symptom or concern that's being addressed. Absolutely. Any others? Is he taking all the medications at the same time or spacing them out? Great. So getting a better understanding of what the timing of those medications are, but also what the adherence or compliance with those medication directions are. So are they taking that metformin twice daily? Are they taking lisinopril and hydrochlorothiazide once a day? Are they maybe by accident taking one of those twice a day, since they have some meds that are twice a day? So doing some questioning to identify, are they taking the medications as prescribed? Are they taking them regularly? Have they missed any doses? What symptoms are you having? So is there anything else to be aware of beyond the dizziness? Is the dizziness only when he's standing up, or are there other times? You might also ask if they've had any falls associated with the dizziness, or do they just feel a little dizzy? Were all of these prescribed by your PCP, just to rule out if they weren't written by multiple providers? That's a great question. So looking to see, is this all being managed by one provider, or are they getting multiple prescriptions from multiple entities? That could be an emergency room visit, that could be a primary care doctor, that could be a cardiologist. So hoping to reconcile all that. What other medications are you taking aside from the ones mentioned? That's a wonderful question, and one that we should always be asking is what's in the chart maybe may not actually encompass everything. So that can include other prescription meds that maybe that system or that pharmacy hadn't filled before or weren't aware of. It can include medications that are over the counter, like ibuprofen or Tylenol or vitamin supplements, herbal products. And so asking about all of those things are important because they also could be playing a role into what the patient is experiencing. Another great question, are you keeping hydrated? As the diuretic alone can cause this, right? So hydrochlorothiazide is also a diuretic. So if they're not also remaining pretty hydrated, or they're not drinking water regularly, or they haven't eaten, all of these things could also be playing into the dizziness. So there isn't one great answer as to like, this is the cause of the patient's dizziness. We'd have to be asking a lot of those questions. But as a pharmacist, I'm already thinking, okay, dizziness, that could be related to hypoglycemia. That could be related to the blood pressure medications being too high. And so we likely could possibly make an adjustment based on the symptoms once we rule out some things. So what we would be doing as the pharmacist here is doing a lot of what you've already said, asking a lot of questions to review the medications, assess the symptoms being reported, identify possible side effects or other causes that could be contributing, and coming up with a solution, either to resolve directly with Mr. Lopez or to talk with his provider or team about what we could be doing next. So some examples of next steps might be recommending home blood pressure monitoring. That might include helping the patient get access to a blood pressure cuff. That might help be involved in a next check-in to see how the blood pressure checking at home is going. We might be considering making a dose adjustment to the current medications either today or following the follow-up that we might have in a couple of days with Mr. Lopez. And then also communicating and coordinating with his medical team. So if we are making recommendations, if we are helping him get access to a home blood pressure monitor, if we're having him follow up with us in a couple of days, we likely would be communicating with the team to, one, help coordinate those things, and two, to ensure that all members of the healthcare team are looped in. So if the provider had referred them to us, for example, or we had seen Mr. Lopez following a provider visit, we would like to kind of follow up with them to ensure that they are aware what's going on. If we're in the community setting, we might be following up via fax or a phone call to kind of let them know about the side effects the patient has been experiencing. All right, we'll do another one. So medication mystery. I like to kind of think of pharmacists as also being detectives. So if you're someone that really likes puzzles or solving mysteries, or just critical thinking in general, that is a big part of what pharmacists do. And so let's kind of work through this example as well. So we have a patient that's taking these three medications: diphenhydramine, melatonin, and oxycodone. They report feeling, I'm very tired during the day and I can hardly get things done. What do you think might be happening? Does anyone know what all of those three medications are? Relaxants? I mean, maybe that could cause a little bit of drowsiness potentially. Does anyone know what we might use those for? So oxycodone, yes, is a pain reliever. If you're familiar with a certain pain reliever class called opioids, they are part of that. If you've heard in the media and in just kind of public health currently, we have pretty much an opioid issue in our country of patients that are on opioids that maybe either don't need the pain relief or are requiring constant opioid usage because they have a dependency. Uh, let's see. How often are you taking the opioid? There's a lot of CNS depressants that could lead to drowsiness. One of those is Benadryl, which also can cause drowsiness. Allergy, sleep, pain management. Wonderful. So we have diphenhydramine, which is AKA Benadryl. So this is an over-the-counter antihistamine. Not all of our antihistamines cause drowsiness, but Benadryl significantly causes drowsiness, which is some of the reasons we've come out with some better long-acting options that do not cause that side effect. But in addition to causing drowsiness, it also can cause a lot of other side effects. It can cause some dryness and some dizziness as well. Melatonin is a herbal supplement often used for helping people to sleep. So makes sense that that might be contributing to the dizziness. The thought behind melatonin is something your body naturally produces to help you move through the normal sleep cycles. And so by supplementing with melatonin, the idea is you're kick-starting your body into that traditional cycle of sleep. Many patients find that helpful. Some patients don't see any benefit at all. Some will just feel a little bit drowsy and then it wears off. So that also certainly can be contributing to the drowsiness. And then oxycodone as a pain reliever, that certainly can be causing some drowsiness here. So we have three medications that could be causing drowsiness and tiredness. We would certainly want to have a better understanding of when these are being taken. So are they all being taken together at bedtime? Are we taking some of these in the morning, which would explain drowsiness kind of throughout the day? Are there appropriate reasons for all of these medications to be on board, or can we possibly either, make a recommendation to kind of space them out, to reduce maybe what's unnecessary, or suggest an alternative that might not be drowsy? So if they need an antihistamine, perhaps we switch that to something like Claritin or Loratadine. If sleep is the issue, perhaps we can work with them on actually identifying what are some non-pharmacological ways that we can help with their sleep pattern and sleep habits. A lot of successful sleep remedies are usually not pharmacological. So can we work with you to identify some patterns that we can remedy? And then certainly evaluating for pain relief if there is not either a lot of pain relief needed or they aren't experiencing any pain. Is this something that can be weaned off? We could titrate down, or can that be adjusted and reevaluated on the necessity? So there's a lot here that could be happening and going on. We certainly want to be asking a lot more questions and getting a better understanding of when these medications might be on board. But certainly they could all be playing a role in what the patient is experiencing.
All right. So hopefully with those two activities, you're able to see a little bit more about how pharmacists really think through these situations and to really look past maybe what people typically see when they see pharmacists doing their job. And so we really wanted to highlight with the rest of this presentation where all of this thinking goes on. And there's a lot of different settings, as Dr. Nuziali mentioned. There's some that are very patient facing, and there's others that are a little bit more in the background, if that's your thing. And so we're going to briefly highlight some of the main areas where most people go after they've completed a PharmD degree. And we'll start by talking about hospital, and we'll talk about ambulatory care and community as well. All right, so you're going to see this type of slide in the next couple slides for this presentation. But basically what we've done is we've highlighted a couple things that we think that pharmacists in these settings can typically do or have the authority to do. And we've highlighted them in blue. So I'll go over a couple of these, but I think you'll have access to this later and you can review this later just to see the breadth of all the things that pharmacists can do in these settings. As hospital pharmacists, we're really taking care of all the patients that are admitted to the hospital. And you can really do that either in the central pharmacy, making sure all the medications are getting to the right patients, or you can do those on the specific floors, providing recommendations to the practitioners. So some of the things that pharmacists do in the hospital, they can order and draw labs in certain settings. They can stop or modify medications that have been written by other people like physicians, right? So we are the medication experts. We can help provide that context. It's really important that we are a part of the healthcare team to provide those recommendations. Um, it may surprise you to know that the hospital doesn't have every medication available to them. So there are certain medications that are available and some that are not. And really, that's decided by a group of individuals at that hospital. And so pharmacists can be a player within that group and help make those recommendations as to what medications are stocked at the hospital. Um, Pharmacists are going to be huge in educating in all different kinds of settings. We educate patients when they're going home for their discharge. We educate other healthcare providers when we are teaching them about medications. And then if I draw your attention over the top here, we can even train medical residents. So, those who are going to med school, when they graduate, they have to do postgraduate training. We can play a role in educating those future physicians because, like Dr. Musiali mentioned, we are the medication experts. And so that's just a quick snippet about what hospital pharmacy looks like. As I mentioned, you can be in the central pharmacy dispensing medications, or you could be on the floors, and you can be at specialized floors as well. So cardiology, oncology, if there's a cancer unit, pediatrics, infectious disease. You can work at the emergency department. You can work in the ICU with critically ill individuals. So a lot of different areas of practice, even within just the hospital setting. All right. Let's talk briefly about ambulatory care pharmacists and make sure that we can keep going through here. Um, so when I think of ambulatory care, or when I first heard about it, I thought about pharmacists who work in an ambulance. And that's not the case. I'm sure there are pharmacists who can work in an ambulance somewhere, but that's not what ambulatory means in this case. Basically, ambulatory care means that the patients who are being seen can ambulate or they can get to their clinic. So really, I want you to think of ambulatory care as being like an outpatient or primary care clinic. So if you've ever had to go get a yearly physical, or maybe you caught something and you wanted to go to see your primary care provider, I want you to imagine that there are also pharmacists in those clinics taking care of people with conditions like high blood pressure, diabetes, high cholesterol, and things of that nature. And so ambulatory care pharmacists basically set appointments and they meet with their patients for, up to 45 minutes, even an hour in some special cases, and really hone in on managing these, what we call chronic disease states. And so ambulatory care pharmacists can do a lot of different things similar to what the hospital pharmacist can do. But a couple things that I want to point out here. For one, like I said, they're basically working at what you call a doctor's office. Though as pharmacists, we are also doctors, so I try to stay away from calling them doctors' offices because it gets a little confusing. But pharmacists can also do things like take blood pressure. I'm not sure if you knew that, but we are trained to take blood pressure, and many pharmacists are trained to do things like diabetic foot exams or other what we consider physical assessment type skills. The really big thing about ambulatory care is if you love making connections with your patients and seeing them over the course of many months, many appointments, even many years, ambulatory care is a great way to establish those relationships. And oftentimes in these clinic settings, you have a lot of authority to do things like prescribe antibiotics or prescribe diabetes medications, and really practice at what we call the top of our license. So you can do a lot of really cool things with the medications and starting them and stopping them, plus the added benefit of spending some time with those patients in these intimate appointment settings. All right. And then lastly, you just want to touch on community pharmacists, which are really the main workforce of most people when they go into pharmacy. Community pharmacies are all the places that you can think of, like your corner drugstores, so the major retail chains. There are pharmacies in basically almost every grocery store. So those are community pharmacists. You may know of a pharmacy that's run by an individual owner. We call those independent pharmacies. Sometimes those pharmacies are places that are compounding, so they make different forms of the medication to help for people who maybe have allergies to certain dyes in the meds, or maybe they want to make a medication in a cream that is usually only provided in a tablet. So community pharmacists are in a lot of different places and a lot of different settings. And most often, this is where people typically see pharmacists, and this is kind of where our title of our presentation came from, right? I think a lot of people think that pharmacists are counting the pills in these community pharmacies, whereas they really do a lot more. Um, they, like we mentioned earlier, can take blood pressures. They were really important and continue to be really important in giving vaccines to the community. In certain states, pharmacists can prescribe or even dispense naloxone. So we talked about oxycodone earlier, which was an opioid medication. Naloxone is a medication that can be used to help manage some of the really bad side effects of somebody on opioids and potentially if they're in an overdose situation. And then one thing that I think people often forget is that community pharmacists can diagnose a little bit. So if you've ever been to a pharmacy and you've ever walked through those aisles where they have all of the medications that you can buy over the counter, if you had like a headache or maybe you had acid reflux, a pharmacist is really well trained to talk you through those symptoms, learn a little bit more about what you're presenting with, and provide a really brief diagnosis of whether or not you can take some of these medications to actually treat your condition, or maybe if you need to go somewhere else like urgent care or the emergency department to seek further care. And so community pharmacists play a really big role in triaging or helping people in the community figure out if they can manage their own conditions or if they need some extra help. And so it's a really big role that community pharmacists have, and definitely not something that people think of right away when they think about community pharmacists. All right. And of course, there are a ton of other paths as well. If you are looking to be on the other side where maybe the drugs are being discovered, developed, or you want to potentially help teach some of the new teach prescribers some of the newly developed medications. You may want to work in the industry, working with pharmaceutical companies. I know many pharmacists who work within the veterinary space, so thinking about maybe rural and livestock, or maybe even just small or large animals as well. Pets need medications too, so you got to have a pharmacist to take care of that. And then nuclear pharmacy is a really niche position, but also really cool. If you've ever need to get imaging done at a hospital, the chances are you might have had to take some contrast solution or some other substance for the imaging to work. Well, that needs to be compounded as well. So nuclear pharmacists play a role in making that happen. And so there's a lot of other pharmacy careers available. You coming to this webinar, as well as just being available to check out the booths, are in a great position to learn more about these pharmacy career paths. So pharmacy for me is a great resource for you. We encourage you to continue to use that to learn more about pharmacy. All right, Dr. Nuziali, I'll hand it off to you to summarize and finish up with some PharmD facts.
Yeah, so in summary, pharmacists work in many different areas. They're trained to be the medication experts. We have our skill sets are really around being strong communicators, having a good understanding of the healthcare system, and of course, being good at critical thinking. So hopefully you've gathered that it's more than just counting pills. We combine science, patient care, teamwork, and problem solving to really help improve patient care and improve the efficiency of the healthcare system overall. Some things you might not know, 100 plus careers exists for pharmacy. So if you go to the Pharmacy for Me page, which is likely available to you through this meeting, you are able to see on that website a lot of the different options that exist. Many pharmacists also qualify for roles in public service, which could be useful for possible future loan forgiveness or tuition remission. But here are some examples of also where our starting salary is. For typical PharmD graduates, anywhere from 110 to 130. You add on another 10, 20 for additional training or for moving up into management and leadership as well. So after residency, you can expect somewhere around starting salaries to be anywhere from 120 to 130 and even higher than that, as we're also moving into an era where we're moving into a pharmacist shortage. And so we're starting to see things like sign-on bonuses or additional incentives for joining specific areas of practice. And I think that should pretty much wrap us up. Hopefully that gave you a little bit of some additional insight into what the pharmacy profession can offer. I don't think we mentioned, but Nathan and I are both practicing pharmacists, and we're really passionate about our profession. So we hope that you are as well. And if you are, working towards applying for pharmacy school, we congratulate you on making a good career decision. You may have heard recently that we're one of the top professions for return on investment. So if you hadn't heard that, look into that article from the Washington Post. All right. Well, thanks for joining us, and hope you enjoy the rest of your sessions this morning
Right.
or
And
afternoon.
if you'd like to talk to us more, we've got our booth later on today.
I
Yeah.
was just going to say the same thing. Yes. So thank you again for attending this session. If you do have any more questions for our speakers, feel free to visit them in their booth during the expo hours, which will be today from 5 p.m. to 7 p.m. Eastern. So be sure to check out the Pacific University booth. But please join me in thanking all of our speakers for their time and insights, and please enjoy the rest of the fair. Thank you all so much, and I'll see you in the next session.
Thank you.